this whole webinar is about introducing the strategic priorities, how we see them, what we look at, how we do consulting and engage with clients. Ultimately, we're talking about resilient cloud collaboration. So we've talked about cloud collaboration, the key consideration points, but in healthcare, there are some challenges there that need to be addressed. Yeah, and in certain circumstances, cloud collaboration on its own doesn't quite hit that mark. So the way we look at it is you need that resilient Redphone architecture. So what we've got in this diagram, again, is a very high level view of the kind of components that make up our kind of offering for resilient Redphone. What are the key considerations? Yeah, so it has to be resilient for healthcare. Yeah, that's important. Okay, it has to be always on. So we don't want a failover. So you've got to wait for failover timers, and it also has to give the users a consistent experience. Those are the key things that when we looked at resilient Redphones, those are priorities for us. So that took us into what we've got on the kind of right-hand side there. So I'll quickly just go through the components of what makes it up that environment. So we look at in certain circumstances, leveraging the kind of investment, the kind of architecture that's already in place, so the analog kind of handsets. So most organisations, healthcare organisations, already have a resilient kind of analog Redphone environment. So there'd be no point in ripping all that out and putting kind of fully resilient IP in. Yeah, now that can happen with new buildings, but we have a solution that can facilitate kind of linking into that, yeah, integrated into analog environments. We have a local SBC with direct kind of breakout to the PSTN. Again, we have local call control. So if you lose cloud connectivity for signaling and some media, those devices on net can register with that local kind of call control. And again, then we've got the Redphones. We also recommend having the switchboard as part of that environment, yeah, because the switchboard is kind of that touch point into the hospital. So if there is a disaster and kind of you lose connectivity, flooding, whatever that is, that switchboard will get a lot of calls. So that needs to stay up, yeah, and all that connects back into the environment. We've put 2 hospitals on there, but this can scale out, yeah. So the resilient Redphone is scalable. We've looked at multiple sites, and you've got multiple kind of resilient, high availability SBCs, high availability kind of call control that's all linked together through the network, and analog ports that, if needs be, are kind of resilient too. So that is the kind of the key overall view of the resilient Redphone kind of setup.
I guess just on that piece, you mentioned about the the analog ports and the services we're deploying. So I guess it's all around that single platform, isn't it? So we talk about I guess how you then reduce their management domains so you got services that's simple and easy to manage. I guess as part of this, we do work with customers that talk about integration and interoperability, don't we, as well? So there's a level of this that as you look at them Cisco cloud services, and I guess we've said a couple of times in the call about enterprise PBX functionality, but what does that actually mean in terms of the integration points? We can still leverage SIP, we can still leverage H323 and other services to be able to integrate. If someone had an existing PBX that they said, okay, we're just invested in that, we can integrate that into the services that we have here. But absolutely, a key part of that consideration is looking at how we deliver that within a single platform. And like you said before about the scalable services, you're absolutely right, because this is just a repetitive architecture. It's a fairly low footprint of services that can just be replicated across different sites that have these resilience requirements.
That's a really key point. Yeah, so we're not saying here, you move to the cloud and you completely reduce your footprint. And actually, no, you don't. You need to put some kind of hardware on site. It's very minimal, yeah. So we can we've completely reduced the footprint of hardware on site. But we feel that there is a level of resiliency and risk that needs to be addressed in healthcare that does require on-prem kind of hardware and services. But we're reducing the burden on IT staff by bringing that consistent experience, user experience, and the manageability. Yeah. So if there's a single platform, Cisco based, you can leverage the APIs, the links into kind of administration platforms, the kind of upgrading of the kind of endpoints is all done through one portal. So that's where we looked at. Cloud is good for kind of manageability and serviceability. You need to replicate that on-prem, but give you that 100% uptime, always on connectivity.
Yeah, and you could bring that environment. I guess traditionally you look at some of the Redphone services that are out there that can be quite dated. Security vulnerabilities can be a big issue in them environments. I guess what we're saying here is bring it into that, part of that cloud delivered service, single management domain, something that's kept evergreen, always updated, mitigated against security risk. So even though you've got that, footprint of services on site, it can still be managed by that central portal and still be kept up to date.
Absolutely.